Welcome back to 43 Focus. I'm Betty Halliburton. Now, we've been talking a little bit about what Medical Mutual of Ohio is all about, and there is a difference between care management and management care. Joining us again is Kent Clamp, Chairman, President, and CEO of Medical Mutual, and Ben Zellman, Vice President of Care Management Medical Mutual. Thank you for joining us.
Thank you.
This is really interesting. We have a great opportunity now to explain to our audience what those two are about. So we're going to start off with, first, tell us a little bit about what care management is.
Well, the idea behind care management really is to help members understand how best to deal with their chronic conditions and use the database that Medical Mutual has to help physicians understand what results in the best outcomes for patients. So instead of being purely a gatekeeper, as Kent Clamp mentioned earlier, we're turning ourselves really more into a guide to educate both physicians and patients about how to deal with their illnesses.
Now that's interesting that you said patients as well as physicians.
Absolutely.
It's important that they're all informed and on the same page.
It's very important for patients who have particularly chronic conditions like asthma or diabetes, or patients who have specific conditions, like we're going to talk a little bit, I hope, about our Baby Link program that's designed to help mothers-to-be understand what to expect when they're expecting. And we find that by having the physician most informed, the patient most informed, it really does result in the best outcomes and patients having the best quality care.
Now, since you made that wonderful segue, we do have a segment with Dr. Rose Gabriel talking about Baby Link that was on the 10 o'clock news.
Sure.
Let's take a look at that.
You want to smile? You want to smile? Huh?
Meet Nicholas Weber.
Look at my hands. Want to smile?
He's a healthy 4-month-old baby. But Mom and Dad weren't so sure he would be when their obstetrician noticed a potential problem during Deanne's pregnancy.
Her fetus had an enlarged head size by ultrasound scan.
The news came as a big blow to Glenn and Deanne.
I got very nervous and cried and just very, very worried.
But during that stressful time, Deanne got some extra support from an unlikely source, her insurance company.
What Medical Mutual wanted to do was to really improve the care to our pregnant mothers. And the Baby Link program really improves the care of pregnant mothers.
Baby Link identifies women who may be at risk for a problem pregnancy and provides support by phone any time of the day or night. So, while she waits to hear the cries of her newborn, a Baby Link mom can reach a nurse who can answer questions and soothe fears.
It was really neat. They offered that I could call them anytime. There was a 1-800 number, and I could call them anytime with questions about the pregnancy, about the baby.
As you can see, Nicholas is doing just fine now.
Head is actually not that large. Huh? No, not really.
But Deanne says she's glad she had Baby Link to turn to.
It's sort of an added support besides the doctor's office.
Dr. Rose Gabriel, the 10 o'clock news.
And that is one example, again, of care management.
Right.
What I like about that is the 24-hour, that a day toll-free number that you can call.
Sure. One of the things that people suggest as a problem with managed care is less access to your physician. And at that 800 number, trained obstetrical nurses are there to answer questions from moms. Even dads can call about any question that they have.
24 hours a day.
24 hours a day, 7 days a week, about something that you might feel uncomfortable, for instance, calling your physician about. But to talk to a trained obstetrical nurse, not an insurance company person or a clerk somewhere, but someone that has dealt with delivering babies and understands when it's appropriate to go to the physician, when it's a normal symptom, and you can just, call them the next day to give them a report. That's something we find that the women who are enrolled in Baby Link really find most attractive about the program.
Are there other programs like this? How does your programs compare to others?
Well, I like to call them, we have the LINK program. We're trying to develop an asthma, diabetic, various heart types of programs that we believe gives, as Ben mentioned, the proper information to both the doctor and to the patient so they know what to expect and ways to improve and have a higher quality of life in the future.
it sounds like some partnerships that are working. I mean, there is definitely that link there.
Most definitely. It's the link to the local physicians, the local community, really, that helps us make these decisions. And the physicians who are making these decisions in the program are really physicians who are practicing. In the BabyLink program, they're delivering babies. In the asthma program that we have, that we're introducing, called Breathe Easy, it's pulmonologists and physicians who are treating patients who have asthma. Also for chronic obstructive pulmonary disorder, it's a lung disease, the same kind of thing. We're directly involving physicians in the community to develop guidelines and treatment protocols, and then because of Medical Mutual's database, we're able to provide feedback to physicians as to how they comply with these protocols. People say managed care can be very negative, but care management has some very positive things about it. For instance, doctors knowing what drugs to prescribe. It's hard to keep up. You mentioned in the segment earlier talking about technology assessment. Well, new drugs come out all the time, and physicians need help in understanding what's the most appropriate therapy. For the last 10 years, there's been data that shows that most ulcers are actually biological in nature. It's not because you don't eat right or not because you're too tense, but that you've got literally a bug. Well, there is a pharmaceutical treatment for treatment of ulcers, and we find that by simply telling physicians about it, if they're not prescribing drugs that indicate they understand that it improves the treatment of ulcers, it makes patients happier, it makes the doctors happier, and it works out well for everyone.
Okay, now so that we understand, and I'm the person that asked the questions, and there may be somebody out there in the audience this morning that may not understand again, care management and management care, the distinct differences are?
Well, the distinct differences between managed care is more purely a gatekeeper type of role where we're reviewing claims, and really it's done on, I'll say, less of a cooperative basis. In care management, we're really involving the physician, we're involving the patient, and we're acting as more of a guide in contrast to a gatekeeper. We're trying to help people be healthy. We're trying to help physicians understand what the best therapies are. We're providing data and feedback. And those aren't typically characteristics that you'd necessarily find in a managed care environment. We believe at Medical Mutual it's very important to have care management approach in contrast to a pure managed care approach.
And I think and you may want to add, tap in on this too, the image of your company. I have to say this because there are so many different ones out there when you're talking about insurance,
Sure.
when you're talking about, I mean, trying to decipher it and figure out what's best for my family. But when you have something like this, it makes it a little more easier to understand that you're not just the gatekeeper. You are actually concerned. Is that fair to say?
Exactly. We try to, for your premium dollar, we want to add the most value we possibly can. And that's getting closer to our customers and so they can understand what we're trying to do and understand what they're trying to accomplish with their dollars.
Now, you made a couple of points, too. Now, you have the Breathe Easy program.
Right.
And you have something basically to do with diabetes
Correct,
as well?
a diabetes education and high-risk assessment program. A similar type of program where we're attempting to educate patients who have those chronic conditions as to how to best cope with their diseases. You mentioned, are these programs similar to or different than other companies? We think every patient who's enrolled in a healthcare plan ought to have access and ought to see demonstrations that their plan cares about them. And we think the BabyLink program, the Breathe Easy program, our diabetes, our congestive heart failure program are real demonstrations of that.
And with that 24-hour-a-day hotline, toll-free, I should say, it's 1-800-338-4114.
Right, that's the number to enroll in the BabyLink program.
Enroll in the BabyLink, but
That's
there is
right.
a special number that they call
That's right,
at any
yes.
time.
That's right.
Okay, Breathe Easy. Now we talked a little bit about diabetes and the pulmonary. The bottom line is there's some specifics that you're dealing with. How did you come up with all of the different components? You looked at what? Research to determine the number of problems with diabetes, the cares or the needs of your clients?
One of the advantages that we have is a very strong data warehouse. We examine what are the illness conditions most prevalent in the Medical Mutual patient population, and then we discuss those issues with a group called the Clinical Quality Improvement Committee, which is a group of local and regional physicians who help us to decide where we should focus our care management efforts. That group decided that it was appropriate for us to improve the treatment of asthma, that there were some existing protocols developed by a federal entity called the Agency for Healthcare Policy Research, AHCPR, and that entity has developed some protocols which we examined and modified for local use, and then we sent them out to our physicians. On a regular basis, we look at those physicians who are treating asthmatic patients, and we give them feedback as to how close they are or far they are from those protocols. That's an example of a specific. Same thing for diabetes treatment. There's also a low back program that we're developing, and I think you mentioned earlier a program affects a small number of people, but who are very high cost, and that's a transplant program.
Tell us just briefly about that. How does that come into play?
Well, each of the programs have similar components. They try to determine, usually through some form of an interview, how prepared that patient is and how much the patient knows about what the best way is to deal with their illness. In the asthma program, we try to target specific patients, those, for instance, who've been admitted, let's say, 2 times in the last 12 months to the hospital, and we look at whether or not there are durable medical equipment solutions, issues in the home or with community support that might make it likely that the patient could better deal with their illness. As a result of that type of patient-specific program, we're able to reduce the incidence of usage of emergency rooms, as well as make it so that patient doesn't have to get admitted to the hospital anywhere near as frequently.
That's important, very important in the reduction. We just have a few, I should say, seconds left, but I wanted you to just give us a bottom line here. Where it concerns your company, what's the bottom line and what you're trying to do? We're entering the 21st century. And people are talking a little bit more about prevention and getting to the problem before it gets too late, before you have to come to the hospital. But where this program is concerned, what do you have to say as far as the bottom line?
The bottom line is quality of life is what we're trying to sell. You know, when somebody gets real sick, you know, you're going to be able to go to an inpatient stay, but we prefer to have you stay out of the hospital, stay well, and be a productive, whether it's employer or citizen in your community.
Well, thank you very much. I'd like to, again, thank you, Kent Clamp, and also Ben Zellman from Medical Mutual of Ohio. There's more 43 Focus after this.